This presentation is concerned about distributing the oxygenated blood along with its nutrients to all parts of the body. It begins in the left ventricle. When it contracts, it pushes this blood with this type of quality into all parts of the body. Let's go back to basics. By now you know the basics that we were following through our gathering of knowledge, and it is time to bring back the common sense. Unfortunately, common sense is not common. If somebody acquires a common sense, then lots of things in his life will be much easier, even in science. One of the very bad advices is don't make me think. That is very bad. In science, thinking is very important. Now, what is the story and where does it begin? At this point of time, we know that the story of delivering oxygenated blood and nutrients to tissues starts at the left ventricle, and this is the starting point, and let's follow this story. The highlight of the story is that the last part of the arterial system, which is the arteriole, is going to feed the capillaries, and these capillaries, they lie between cells of tissues, and after doing the job of the capillaries, the blood goes to the veins with less oxygen, less nutrients, and more waste material. Let us hit the target of the question: why do we have the vascular system? And in the first part, why do we have the arterial system? This is our target. What is the description of this target? It has several parts. Arterioles are what? Arterioles are the smallest arteries that are at the end of the arterial system. This is going to enter the spaces between tissues containing the cells, and it brings tissue fluid. What does tissue fluid contain? It contains oxygen and several types of nutrients, and this fluid is going to bath the tissue cells. They are going to be surrounded by this interstitial fluid and the rich one, and then they take whatever they need and throw out whatever they don't need, like waste and different things. And then we have capillaries that will pick up the wastes and send it to a venule. What is a venule? A venule is the very beginning of the venous system, and this image is also telling me that the capillaries, the smallest part of the vascular system, which are found where? They are found between tissue cells, and these capillaries are divided into two parts: the arterial side, delivering things, and the venous side, picking up things. And this is an image of continuity between the arterial side and the venous side, while in the heart they were totally separated. Here they are connected, and blood never leaves the vascular system. In addition to that, if foreign bodies are found in this place between tissue cells, or large molecules are there, or anything that veins cannot pick up, we have another system called the lymphatic system. These lymphatics, they have capillaries in between the cells, and they have gaps, and they can pick up the large particles, the large bacteria or pathogens, and send them back to the venous system. We will address the lymphatic system if we have time at the end. This is a cross-section of a blood vessel, and we can say it is a cross-section of an artery, and it has a lumen, space where the blood flows in. What does the blood need? It needs very smooth surface so that it does not clot. This smooth surface is supplied by what? It is supplied by simple squamous epithelium called the endothelium. And this endothelium has little amount of loose areolar tissue underneath it, and these two components, the endothelium and the loose connective tissue, is called tunica intima. Intima means is in close relation. Close relation to what? To the flowing blood. Next, and outer to the tunica intima, is tunica media. We can see that tunica media is the thickest layer, and what is it made of? It can be made of connective tissue or muscle, and can be a combination of these two. Then we have tunica adventitia, made of loose areolar connective tissue, and common sense tells us that arteries should not lie loose between tissues. They should be attached to the surrounding structures, and tunica adventitia will do that job. It is time to write some notes. Now, the arterial system structure is made of tunica intima, and tunica intima is made of endothelial cells. These are simple squamous cells, and there is a subendothelial layer of loose connective tissue, and then this epithelium or this endothelial cells have this continuous basement membrane. Then the middle layer is called tunica media, and it can have elastic membranes, smooth muscle cells, and this is the thickest part of the wall Then tunica adventitia, this is a thin layer of connective tissue fixing the arteries to surrounding structures. Now, concerning the arterial system, here are some facts that we need to know beforehand. And the first thing is that there are large arteries, and they are elastic arteries. And what are they called? They are called conducting arteries. Then these arteries will branch into smaller ones as they go along, and these are called medium-sized arteries, and they usually have smooth muscular tissue in tunica media, and they are distributing arteries, not conducting. And next is a smaller group of arteries. They are called arterioles as they reach the cells of tissues, and then smaller ones which are called metarterioles. Metarterioles are very important because they supply the capillary bed. What is the capillary bed? Is the capillaries between cells of tissues, and they have the last ring of smooth muscle cells in their tunica media, usually one layer, and this is called pre-capillary sphincters. If these pre-capillary sphincters contract for some reason, blood pressure will be rising and less blood is getting into the capillaries. And then the smallest element of the arterial system is the capillaries. This is a diagram of two sets of the vascular system. The upper one, which we are concerned with, is concerning the arteries, and we have the elastic arteries made of three layers, the tunica adventitia, and then tunica media, and on the inside is tunica intima. And then when these conducting arteries, when they get smaller, they become muscular arteries, and they are also made of three layers, and then they get smaller and smaller, and we reach the stage of arterioles. All of them have three layers in their walls. This is the real thing. This is a histological section of an artery where you have a lumen, then you have tunica intima, and you can see that the line is pointing at the simple squamous epithelial nucleus. And then we have the internal elastic lamina, this zigzag continuous line underneath the endothelium, and then the tunica media is made of several layers of smooth muscles, and you can see the several layers of elongated spindle-shaped nuclei of smooth muscles, and on the outer side it is the tunica adventitia made of loose areolar connective tissue. This is a histological section of which structure? An artery. It has a lumen filled with blood, and the dark spots are the nuclei of the endothelium, and then we have the smooth muscle making the thick part of tunica media. There is no harm in repeating scientific information, because it is useful to fix this information. Here we have a lumen of an artery, and then tunica intima, the internal elastic lamina, which is the dark stained structure, zigzag form. Then we have tunica media, and in larger arteries we have external elastic lamina as well as an internal one. And here is the adventitia, which is very evident. The thickest layer is the tunica media. Although we are not far away from the beginning of the story of the arterial system, it is useful to check your understanding. Here is a tunica media of which part of the arterial system. Now, I will not give a conclusion on this slide, but I'll leave this to you, because you know what kind of connective tissue is this, and when you know it, you know whether this is a large artery or a medium size or a small one. Here is a wall of an artery, and you can see they are marked, the lumen, the different layers, and this is an exercise for you to decide what is the type of this artery and what is its size. When we get down to the smaller and smaller arteries, we get to the stage of small arteries and the beginning of arterioles, where you can see a lumen filled with blood, the endothelium, two layers of smooth muscle cells, and little adventitia around. This is a very small artery, and in comparison to an accompanying vein, which has larger lumen and thinner wall. What are these structures? These are blood vessels. What size of blood vessels? These are the smallest blood vessels. What are they made of? They are made of only the inner layer. What is the inner layer? It is an endothelium, little connective tissue, and then a basement membrane. No media, no adventitia. And what are they called? They are called capillaries. Where do I find capillaries? I find them at the end of the arterial system. In which place? Between cells of tissues. Why do they have a single layer? So that things can go in and out to cells. Then, what is this process called? Physiologists call it diffusion. Now, are all capillaries of the same type? The answer is no. Why not? It is going to be according to the function of the organ, function of the cells. Some organs have always one type of capillaries specific for that tissue, and the first type is what is called the continuous capillaries, and they have a basement membrane and in the tunica intima made of endothelial cells, and these endothelial cells, they have intercellular clefts where they are connected together. These are usually found in muscles. Then we have fenestrated capillaries. Where are the fenestrations? The fenestrations are in the endothelium of these capillaries. And where do I find this type of capillaries? I find them in the kidney. Then we have sinusoidal capillaries. Sinusoidal capillaries, their basement membrane has large gaps and it is incomplete basement membrane plus gaps in the endothelial cells, and these are called sinusoids. They have larger lumen and they are found usually in the liver. This view is left to you to practice your knowledge. Here is a very important subject, and that is the story of the terminal arteriole. What does the terminal arteriole do? It is going to give a branch to feed the capillaries. What is this arteriole called? It's called the met arterioles. Is there anything special about the met arterioles? The answer is yes. When it branches to a capillary, it is going to have this structure. What is this structure? This is a ring of smooth muscle at the very beginning of the capillaries, and this is called Pre-Capillary Sphincter. And this sphincter, when it contracts, it is going to supply less blood to the capillaries, and it is going to increase the blood pressure. Therefore, this pre-capillary sphincter controls how much blood is going into the capillaries. This is a good exercise for you to practice your knowledge on the structure of an artery. This is a histological section of an artery with an accompanying vein, and you can see the difference between the arteries and the veins, and this is something we will address later on when we talk about veins. At this point of time, we had a good knowledge of what is an artery, what are the types of arteries, what is the target of the arterial system, and what are the importance of the arterial system, the pre-capillary sphincter, and the capillary bed, the venous side of capillaries and the importance of the lymphatic system. Now we are going to talk about the arteries supplying the different parts of the body. There are a set of arteries coming out of the heart, and they are called the greater vessels. Then vessels will go into the head and neck. Blood vessels will supply the upper limb, the thorax, the abdomen, and the lower limb. What is this? This is an anterior view of the heart. And this structure is the beginning of the aorta. What's the aorta? The aorta is the largest artery in the body. From where does it come? It comes from the left ventricle. What type of an artery is it? It is an elastic artery. When the left ventricle pushes blood into the aorta expands, and because it is elastic, it is going to come back, and this coming back is going to add more force for the blood to go in, and this is called the ascending aorta. Then the aorta is going to curve, and it curves where? It curves to the left, and this is going to be the aortic arch, and the next is the arch of the aorta is going to come down behind the heart on the left side, and this is the descending aorta. It descends where? It descends in the thorax. Therefore, it is called the descending thoracic part of the aorta. Now, we come back to the arch of the aorta. The arch is going to give on the right an artery. This artery is going to be called the brachiocephalic trunk. Why brachiocephalic trunk? Why trunk? Because it is a large artery, and brachio means the humerus, the part of the upper limb, and cephalic means the head. So this is a large artery going to supply the upper limb as well as the right side of the head and neck. Then to the left is an artery which is called the common carotid artery. This is going to supply the left side of the head and neck, and to the most left is the subclavian artery, which is going to supply the left upper limb. Why subclavian? Because it is under the clavicle. Now, as you can see, there are three branches of the aortic arch. The right side of the head and neck is supplied by an artery which is going to divide later on into common carotid and subclavian, while the left side of the head and neck branches, they come from the arch of the aorta. So instead of having 4 branches, we are having 3. Why is that? Because the arch of the aorta is moving to the left. So when it is moving to the left, it can give arteries to the left side of head and neck and the left upper limb, while because it is moving away from the right, therefore it gives a trunk which is going later to divide into arteries supplying the right side of the head and neck and the right upper limb. Here's more clarification of the fact of the arch moving from right to the left. And this is the ascending aorta, and this is the arch of the aorta, and this is the descending aorta, and the arch of the aorta is going to give the brachiocephalic trunk. Sometimes in some references the brachiocephalic trunk is called the innominate artery, not named yet, and this innominate or the brachiocephalic trunk later moving to the right, it is going to give the subclavian artery supplying the right upper limb and the common carotid artery for the right side. On the left side, the common carotid artery comes from the arch itself. It does not need a brachiocephalic trunk. Why is that? Because the arch of the aorta is moving to the left, and the same story goes for the subclavian artery on the left side, because the aorta is going to the left, therefore it gives the left subclavian artery. The next part of the story is as the common carotid artery goes to the head and neck on the right and left. Now, the story of the subclavian artery. This subclavian artery is going towards the upper limb. Therefore, it travels on top of the first rib and makes a groove on it. And we know this information when we studied the first rib. As it reaches the lateral margin of the first rib, it is going to change its name. It is not going to branch. It is going to change its name according to the position of the artery. After crossing the lateral border of the first rib, it is going to be called the axillary artery as it enters the axilla. Although we are not far away from the beginning of the story of the arterial system, it is useful to check your understanding. Here is a chance for you to check your understanding of the asymmetry of supplying the right side of the head and neck and the upper limb and the left side of the head and neck and the arm. Now, as the ascending aorta comes from the left ventricle and curves and descends into the thorax, where it is called the thoracic aorta, and it gives to the right side the brachiocephalic trunk. This trunk is going to give the right common carotid artery for the head and neck on the right side, and gives the subclavian artery going to the upper limb. This subclavian artery, as it travels under the clavicle, enters the axilla or the armpit and it changes its name as it crosses the lateral border of the first rib, and then it changes its name again into the brachial artery going to the arm. The brachial artery, now, as you have noticed that the arteries of the limbs are named according to the bones they are beside these arteries. Now, the left common carotid arises on its own without needing a trunk, and it is going to supply the left side of the head and neck. And then the left subclavian artery also arises directly from the arch of the aorta. These are minor branches which we are not going into details of these minor. This is a view of the thorax showing the heart, the aorta, and let's follow the arrows. This is the most right branch of the arch of the aorta, which is the brachiocephalic trunk, and it is going to give a branch called the common carotid to supply the head and neck on the right side, and then subclavian artery under the clavicle, and then it is going to change its name into the axillary artery, and then the brachial artery going into the arm on the side of the humerus. And this is the continuation of the brachial artery. On the left side, we can see that the common carotid and the subclavian, they arise on their own from the arch of the aorta. Now, the brachial artery, as it comes on the medial side of the humerus, it is going to bifurcate. That means it is going to give two branches. The ulnar artery runs on the little finger side or the medial side, and the radial artery is going to travel along the lateral border of the radius, and the radial artery is the most used artery for checking of pulsations at the wrist. And these two arteries, the radial and the ulnar, will create arches in the palm of the hand, superficial arch and a deep arch. And from these arches, the digital arteries arise and go and supply as far as the tip of the fingers. This is the part of the story of the common carotid artery. Now, the common carotid artery is going to bifurcate, to divide into two arteries. The internal carotid artery is going to enter the skull and supply the brain and the meninges. We are not yet concerned about this distribution of this artery, but the external carotid artery is going to supply the face and the scalp, and one of the branches here, this one, is the lingual artery, which is going to supply the tongue. As it goes up, it gives this branch, which is just behind the angle of the mandible on the inside, and then this is going to be related to the submandibular salivary gland, and it emerges from the lower margin of the mandible and enters the face. Therefore, this is called the facial artery. As it goes up towards the angle of the eye, it gives a branch to the lower lip. It's called the inferior labial, and then goes up and supplies the upper lip, and this branch is called superior labial, and then it goes to the angle between the eye and the nose, and this is the facial artery. What I can see of the facial artery is that it is tortuous. It is having many curves. Then the external carotid artery will go up and gives a branch called the maxillary branch. It enters the infratemporal fossa, the space deep to the ramus of the mandible, and it is going to give many branches to that area, and this is called the maxillary artery. And then the final end of the external carotid is going up in front of the ear to supply the temporal area, and this is called the superficial temporal area. So what is the terminal branch of the external carotid? It is the superficial temporal artery. Then posteriorly it gives a branch that is going to posterior to the ear, going towards the occipital area, and this is called the occipital artery. It also gives a deep branch to the pharynx, which is not visible here. In this image we can see the facial artery giving rise to the superior labial and supplying the external part of the nose. In this view I can see that the external carotid artery branches are supplying the face, the lateral part of the scalp, and the posterior part of the scalp as well. This is a closer look at the maxillary branch of the external carotid, where you can see that as it enters the infratemporal fossa, it gives around 15 branches in this infratemporal fossa and the maxilla at the front of this fossa. This is a lateral view of the neck and the head, and you can see the plan of what artery and what are the branches of this artery. As the thoracic aorta only giving the posterior intercostal arteries, the aorta gets into the abdomen and it gives anterior branches, 3 of them, and it gives lateral branches. The lateral branches are a set on the right and a set on the left, while the anterior branches, they are single ones. This artery comes higher up in the abdominal aorta, and it is going to supply structures on the right and on the left, like the spleen, the stomach, and the liver and part of the duodenum. This is called the celiac trunk. Then, just a centimeter or two inferior to the celiac trunk, another anterior single artery emerges, and this is the superior mesenteric artery. This is an artery that has a wide distribution. As it comes down the right iliac fossa, it is going to give several branches to the small intestine called ileal branches, and then it starts supplying the right side of the colon, and this is the ileocolic artery, the middle colic artery, and then the third artery coming from the abdominal aorta anteriorly and a little bit to the left is the inferior mesenteric artery, which is going to supply the left part of the large intestine, and this is the left colic artery, and this artery is going to the sigmoid, therefore it is called sigmoidal artery, and this is going to the superior part of the rectum, and it is called the superior rectal artery. This is an anterior view of the abdominal aorta as it comes into the abdomen under the cover of the median arcuate ligament of the diaphragm, something we have seen before, and as it gets into the abdomen slightly on the left, it gives anterior branch that is called the celiac trunk or celiac artery. It is going to supply organs in this area, which are the spleen, the stomach, the liver. It's going to supply the diaphragm and part of the duodenum. Few centimeters below, 1 or 2 centimeters, is a branch that is called the superior mesenteric artery, which is going to run in the mesentery of the small intestine, and it is going to supply the ileum, the jejunum, and it is going to extend its blood supply to the large intestine, especially the right side of the large intestine, the cecum, the ascending colon, and part of the transverse colon. Then, slightly inferior to the superior mesenteric, there are two arteries that run at a right angle to the aorta, and they are going to the kidney on both sides. Therefore, they are called the renal arteries. Then, on the posterior abdominal wall, the branches coming from both sides supplying the posterior abdominal wall, and they are called the iliolumbar arteries. Before the bifurcation, there is another anterior branch, a single one, which is called the inferior mesenteric, which is going to supply the left part of the colon, the descending colon, the sigmoid, and upper part of the rectum. Then the aorta at the level of L5, it is going to branch, to bifurcate into two branches. Each one is called the common iliac, as it is going towards the ileum of the hip bone, and then the common iliac is going to give a branch to the pelvic organs like the uterus, the rectum, the ovary, the urinary bladder, and this branch is called the internal iliac. The word internal means that it is going to supply structures inside the pelvis. Then it continues as the external iliac, and as it passes under the inguinal ligament and enters the anterior part of the thigh, and this is called the femoral artery. Give a branch called the deep femoral, which is supplying the posterior hamstring group of muscles, and as it comes down at the lower end of the femur, it is moving posteriorly and enters the popliteal fossa, and it is called the popliteal artery. Here is a closer look at the external iliac artery as it comes down and passes under the inguinal ligament and become the femoral artery. This is a posterior view of the lower end of the femur, the knee joint, and the upper end of the leg, where we can see that this is the femoral artery becoming posterior, and as it becomes posterior to the knee joint in the popliteal fossa, it changes its name to the popliteal artery, and it comes down and continues as the posterior tibial. Near the upper end of the tibia, there is a fibrous membrane connecting the fibula and the tibia. There is a hole in it, and into this hole a branch coming from the popliteal and goes to the anterior compartment of the leg, and it is called the anterior tibial. This is a simple exercise for you to name the artery at the point of the arrow, and then go posteriorly and name the artery coming down behind the ankle joint. Here is a view of the thoracic and the abdominal aorta, and as a summary, you can see that this is the thoracic aorta, and it gives posterior intercostal arteries, and it pierces the diaphragm and becomes abdominal aorta, and divides into two common iliac arteries, and the continuation is going to be the external iliac going down to be the femoral. Sometimes repetition is useful, or it is better called revisiting, and this is something you know. This is external iliac, femoral, as it passes under the inguinal ligament and continues as femoral, and higher up it gives a branch that is going to the posterior compartment of the thigh called the deep femoral, and then the femoral becomes posterior to the knee joint to become the popliteal arteries, and from the arches digital branches coming out of these arches. The next few slides are like this, and they are called flow charts of the arterial system, region by region. You have something like it in your book, and it is optional for you to go through it or not.